Welcome to Physio Explained. Today we'll have a short introduction about physiotherapy where the science meets healing hands. So just imagine a stroke patient who is unable to walk regains the ability to take his first independent step, or a young athlete returns to the field after a ligament injury, or our grandparents with chronic knee pain climb stairs again without any fear. So what is your idea that who is the background here? Who makes this possible? Definitely a physiotherapist. If you think physiotherapy is a science, yes, it is a science as it is dealing with the foundation, right? So if we say physiotherapy is a science, then we can see that it is evidence based. It is evidence based because it's dealing with the practice. You're going to learn more of anatomy, physiology, biomechanics, and also clinical reasoning, and you are going to provide a measurable outcomes. If you think that physiotherapy is an art, yes, it is an art because you are dealing with human. You are dealing with human, which means you're going to communicate with them, you're going to show empathy, you're going to adapt new techniques to teach each patient unique needs, motivate them, encourage them, and you keep on building their trust. Okay, for example, you may scientifically know that quadricep strengthening helps knee osteoarthritis, but the art lies in how you teach the exercise to an elderly patient who is anxious, in pain, or discouraged. So, you are going to make it safe, comfortable, and motivating so they actually do it. This is where the mingleness or the togetherness of the science and art occurs. So, if you only had a science, you would risk being mechanical, or if you only had the art, you would lack evidence based effectiveness. So, we can say physiotherapy thrives at the intersection of both, that is, both the art and the science. Now, let us discuss what is physiotherapy. Physiotherapy is a science and art, as I have mentioned, of restoring, maintaining, and enhancing the physical function and movement of the subject using hands on therapy, exercises, equipments, and also you are going to educate the patient without relying mainly on the drugs and surgery. So you are going to treat them, you are going to analyze them without using any drugs or surgery. So you can say that physiotherapists are like a movement engineers diagnosing the mechanical faults in the body and fixing them for a smooth and pain-free functioning. So, what is the role of physiotherapy in modern healthcare, or why physiotherapy is so important in the modern healthcare? We have huge variety of points here. One is like holistic care. Next is drug-free pain relief. Next, we are going to deal with rehabilitation. As a physiotherapist, you are going to deal with aging population. Definitely, you have a very important role in sports and lifestyle needs, and also certain special cases where you are going to work as a very, very important person in changing the patient's life. Let us discuss one by one what is the role of physiotherapy in a holistic care where your body, soul, and mind has to be aligned. Holistic care in the sense you are going to treat the whole person, not just the disease. You are going to treat the whole person, not just disease, which means if suppose a patient recovering from the stroke, okay, we'll take this example, stroke may have muscle weakness, right? They have muscle weakness and also they have balance problem, that is imbalance, okay, balance problems. Because of that, they develop low confidence, right? So, as a physiotherapist, when you are dealing with a stroke patient, you are going to address all three issues by giving strengthening exercise to the weakened muscle, by giving gait training, and also you are going to motivate the subject for returning to his normal daily life safely. Next is drug free, surgery free pain relief. You are not going to use a drug, or you are not going to do any surgery, but still you are bringing up pain relief. By reducing the dependency on the painkillers and surgery, you are going to treat the subject. How? For example, if you take the person who is having chronic low backache, okay, chronic low backache due to poor posture. If you think a chronic low back pain can be of any reason, so I'll take here as a poor posture. Okay. So you as a physiotherapist can improve the poor posture by giving targeted stretching, strengthening, and also ergonomic education. So you are avoiding long-term painkiller usage and also unnecessary surgery. If you want any real life story, I can ready to share that for example, a 45-year-old office worker with severe neck pain was considering for the surgery. But after 6 weeks of posture correction and mobilization therapy, her pain reduced by 80% and surgery was no longer needed. This is the beautifulness of the physiotherapy, where you are going to treat this patient without drug and without surgery, avoiding medication overuse, which means fewer side effects and healthier long-term outcomes. Next, the core of the physiotherapy is rehabilitation. This is the backbone of the physiotherapy, because you are going to support the whole recovery across the specialities. You are going to support whole recovery across various specialities. Okay. So it is very, very essential. Physiotherapy is very, very essential if you take for post-surgical. Yes, for example, knee replacement. After knee replacement, physiotherapy plays a very important role in restoring the joint movement, muscle strengthening, and also the changing the walking pattern of the subject or the patient. Okay. Next, in case if you take in neurological, various specialities, in neurological it plays a very huge important role, stroke recovery again, where physiotherapists retrain the brain and body to restore mobility and function. And we do have a role in cardiac rehab. Yes, after heart surgery, a graded exercise programs help improve the healthy heart of the patient safely. Okay. So if you take any example like related to orthopedics, a patient after like anterior cruciate ligament tear, that after the reconstruction of ACL, okay, he need staged physiotherapy program. Okay, he need a staged, carefully designed physiotherapy program. So from basic range of motion exercises to advanced sport drills. Okay, so if you want to play a sport again, he can safely return to the sports after practicing all these staged physiotherapy program exercises. Next, we do have a role in aging population, promoting their independence and also improving their quality of life. Okay. For example, fall prevention programs for elderly, um, preventing their disability is just as important as treating it. So you have a very, very important role when you are dealing with the aging population. Next, a very important role, sports physiotherapy, because you are going to deal with elite athletes, and also lifestyle modification, which means you are going to also deal with sedentary workers. So you are having role from elite athletes to sedentary workers. So you have to know how to program their exercises. Physiotherapy is not just about injury recovery, okay? It's about prevention, performance, and adapting to modern lifestyle changes. Usually, physiotherapists design training plans to prevent sports injuries, sports related injury, how to manage the acute sports related injuries, and guide safe return to the play. In case of lifestyle modification, definitely we can take example of office workers. Okay, office workers with the neck pain, back strain, they benefit from ergonomic support. Okay, ergonomic changes, adjustments, and also stretching routines. Fine. Special cases. So special cases in the sense we have almost role in all the special case areas, starting from the infant to the elderly people. For example, if you take infant cases, we as a physiotherapist deal with development delay. Okay, developmental delay, cerebral palsy. Okay. So for the early intervention using neurodevelopment therapy, play-based exercises, parent education to promote milestones like crawling and walking. Okay. Next one is club foot. Club foot. Okay, is a congenital disorder where a newborn is born with inward turning feet. So here, as a physiotherapist, you are going to provide the stretching, casting guidance, and also post-surgical rehabilitation to ensure proper foot alignment and mobility. Fine. We have a role among school-age children and also adolescents. Here, what the condition you are seeing is scoliosis. Okay, is a scoliosis where a 13-year-old girl was diagnosed with early spinal curvature. Spinal curvature. You can see the alignment is different here. We have to prevent the re-injury. We have to prevent the curve progression and boost confidence among the school-going kids and adolescents. So you have a very important role over here also. And also when you take adult, as I have mentioned before, workplace injuries, ergonomics, fine. So posture training, stretching and strengthening to improve their productivity and also prevent their progression to chronic pain syndrome. Again, ergonomic prevention is needed, adjustments are needed when you are dealing with working adults. Okay? And we do have a role in women health also. For their during their pregnancy or pre-pregnancy or post-pregnancy, core strengthening is needed, pelvic floor rehabilitation, safe exercise prescription in order to restore their confidence, bladder control, and also safe return to their activity. In case of older adults, especially neurodegenerative disorders like Parkinson's disease, stroke rehabilitation, osteoarthritis, we are going to maintain the elderly people's independence and we are going to delay their disability. So, why one should choose physiotherapy as a career? We have been discussing the what are the roles of physiotherapists. So, why one should choose physiotherapy as a career? First one is for a personal growth because you are going to develop a problem solving skill. You are going to develop communication and you are going to show empathy. And you as a physiotherapist is going to build your personal physical fitness and you will be aware of your body. Next one is a patient impact. This is a very important thing. We should be very proud because you are going to witness the transformation. You are going to witness the transformation that when you help someone to walk, when you help someone to breathe properly or move without pain, definitely it is going to create a very long lasting relationship with patients and family. Okay, physiotherapist and patients relationship are very long lasting. And also professional opportunities. Okay, professional or opportunities in the sense in clinical area you are going to work like hospitals, private practice, rehabilitation center, and also specialty areas like as I have mentioned before, sports physiotherapy, neuro rehabilitation, pediatrics, geriatrics, cardiorespiratory, and so on. And you have a global demand. Okay, you have a global demand as opportunities in countries where physios are highly recognized. And also you can be like entrepreneur, you run your own clinic or your wellness center. Coming to the focus, scope, and application of physiotherapy, clinical setting. Like clinical setting in the sense post fracture rehabilitation, stroke, spinal cord rehab injury, and also pain management and musculoskeletal disorder. You can work in sports setting like injury prevention program for athlete, on-field injury management, performance enhancement through biomechanical training. And in community setting also you have a very good scope, like you can have a home-based rehab for bedridden patients. You can go for rural outreach programs for disability prevention. You can do health promotion regarding this posture, ergonomic exercises, and in industries also like ergonomic assessment to reduce a workplace injury, return to work rehabilitation plan, wellness program for the corporate employees. You have a very good scope and applications. Now, okay, I know that I have a very good scope for physiotherapy. Now, how to study physiotherapy effectively at the undergraduate level? Okay, the first thing first is integrate the theory with practice. Don't just memorize. Understand why and how. Why the technique and how the technique works. Okay, link anatomy, physiology, and your biomechanics for the movement assessment. Fine. The next thing is like case based learning. Case based learning, which means practice with simulated or real patient cases. Discuss what would you do if. Just imagine a scenario or and then simulate yourself or discuss about it with your seniors and your professors to understand the real patient cases. Okay. Next one is observation and patient interaction. Just watch your senior physiotherapists work and ask them questions. And also, you have to respect patient privacy while learning. Next is hands on skills early on, which means start practicing therapeutic exercises, goniometry, basic mobilization under supervision, and then practice on your own. And finally, continuous self reflection, which means after each clinical posting, you have to ask, what did I learn? What did I learn? What can I improve? This will reflect yourself and you will improve and shine as a good physiotherapist. So, uh, physiotherapy is more than the profession, okay? It is not just a profession, it is a responsibility. You will be trusted with people's mobility, independence, and also dignity. So, learn with curiosity, work with compassion, and act with integrity. Let your hands heal, your knowledge guide, and your empathy inspire. Okay, your journey starts now. Every class, every observation, every practice session counts. So build your foundation strong and you will be the reason someone walks, runs, or lives a pain free again. Thank you so much.